He's already been dead and it's messed with his head. It's John's post-life crisis.
Welcome to John's Post-Life Crisis. I am John Johnston, founder of CornNation.com, your Nebraska's Cornhuskers site of mental health awareness. This episode, we're talking with Dr. Stephen Wengel. Dr. Wengel is a psychiatrist with the University of Nebraska Medical Center in Omaha, Nebraska. We will be talking about the mental health aspect of COVID-19, the pandemic. Thank you for joining me, Dr. Wengel. Can you give us a little bit of background on UNMC and what you do there?
Yes. Well, thanks for the invitation, incidentally, and the chance to talk about this. So I'm a geriatric psychiatrist by trade. There's not very many of us around, but I was trained many years ago to take care of older adults with mental health problems, people over 65 that have depression or anxiety or schizophrenia, that sort of thing, as well as things like dementia, Alzheimer's disease and other forms of dementia. So that's my main clinical role. I've been doing that for about 29 years. But in addition to that, about 2 years ago, the university asked me to take on a new part-time job. I work full-time for the university, but I see patients about half-time. The other half, I do wellness-related activities. So they gave me a new title. I'm the Assistant Vice Chancellor for Campus Wellness for both UNMC and UNO. And so that's a lot of words, but what does that really mean? My job, I think, mainly is to try to help our students, medical students, nursing students, pharmacy students, and so forth, as well as our faculty and staff, handle stress better. So I do a lot of talks on resilience and trying to lessen the effects of stress. And I was doing that again for the last couple of years, long before the pandemic. But of course, with the pandemic, guess what? We're all under a lot of stress, I think. It's affecting everybody in our country, but around the world, of course, in different ways. And so we've had to kind of redesign the work we do a little bit to try to help our students and faculty and staff, as well as our patients, try to cope with this. It's just it's a unique situation, as you know. It's getting to be kind of trite almost to say it's unprecedented, but it really is unprecedented. I don't think any of us have been through something like this before.
So we've been at this pandemic for months now. By the way, the wellness thing, so you get to basically work with the youngest and the oldest.
That's a good way to put it. Yeah, that's a great point, right? Yeah, I get to work with young folks like our students, our medical students, nursing students and all. And in my clinical world, yes, get to work with people anywhere from 65 up to 100. I actually have patients over 100 years old. So yeah, both ends of the continuum there.
Well, I was going to start with, what have you seen have been the most detrimental effects from a mental health perspective of this pandemic so far? Because we don't know how long this is going to go on. Right.
Yeah, that's a great point. I think 6 months now, at least at the time we're talking here, it's really taking its toll, and I think it's largely having to do with isolation, like social isolation and loneliness, for one thing. Obviously, there are other big impacts for a lot of people. Unfortunately, a lot of people have lost their jobs or have had hours cut back because of the hits to the economy. People that work in healthcare, certainly my line of work in healthcare, it's affected a lot of folks, especially the frontline providers that work with COVID positive patients and the stress that brings. But not just them, of course, too. Teachers, as we sit here talking today, the K through 12 school system has just opened up in the last few weeks, as well as the colleges. So everybody, I think, is struggling. Teachers, parents, students, everybody's struggling, trying to figure out how to make this work and stay safe. And it just takes its toll. I think this constant change, the rules changed. Are masks good or masks bad? Well, now we realize masks are a good thing. Normally, obviously I'm just sitting in my office with the door closed, so I don't have a mask on right now. But normally, I guarantee you, as soon as I leave that office door and I go out into the hallway, I've got a mask on every minute of every day. I believe in them. But, we didn't know that a couple of months ago, so the rules change. the state of Nebraska is now opening up again because our rates are relatively low. And that's good because now we can get back to some semblance of normality, but we still have to be really vigilant. So anyway, that constant change, kind of keeping track of the rules. What are the rules today compared to a week ago? It's hard. We're adaptable. It's good. In some hands, so stress is an interesting thing. We all need some. Think about weight training, for example. So think about, normally you'd be talking football probably and weight training and, the weight room and all that. You have to stress your muscles to make them bigger. And so stress isn't all a bad thing. So we all need a little bit of stress at least, or else we don't improve. We don't get better at what we do. Our muscles don't grow stronger or whatever. So a little stress is a good thing for you, but too much stress, not such a good thing. It causes a lot of anxiety and sometimes depression and, takes its toll in many different ways.
So I mentioned that you're working with the youngest and the oldest. Do you see differences in how age affects people in dealing with the stress and dealing with the anxiety that we're going through, the uncertainty?
Yeah, I think that's a really important question. I think so. Yeah, I would say so. So older adults, my clinical population, the folks I see when I'm wearing my doctor hat, on one hand, what you think about, if you think about the average 75 or 85-year-old, they've lived through a lot of stuff. To make it to that age, they've lived through some tough times and they've overcome them. They've had losses. They've lost loved ones and friends. They have probably battled one or more health scares of their own and people around them. They may have lived through natural disasters and economic problems and so forth. And they've lived to tell the tale. And I think when you live to tell the tale through those things, it does make you stronger and kind of helps you put things in perspective. Whereas, somebody that's younger that hasn't lived through something that stressful, this can seem really, really super overwhelming. So on one hand, I think older adults maybe have a perspective that the rest of us don't always have. On the other hand, many older adults, not all, but some at least, are more vulnerable to some of the problems here because they are socially isolated. Somebody that lives alone, for example, and may be afraid to go out of the house and go shopping and such, whereas a middle-aged person might not have that problem, or a younger adult might not worry so much about that. Older adults living in long-term care settings like nursing homes and assisted living places, on one hand, they've got other people around them, but on the other hand, they may be confined to their room. I did Zoom visits this morning to a nursing home that I provide care to, and I think almost half the patients I saw were talking about the stress of not being able to go outside, not being able to have visits with their family. I mean, they're doing it through Zoom and their tablets and their smartphones and all that, which is great, but it's not the same. It's not the same as being in the same room. And some of them are talking about, gee, I've got grandchildren that they haven't seen yet. They've never met because they can't do it, So it's a challenge.
So when this pandemic first started, there was this kind of an attitude that, okay, we're going to do this lockdown thing for maybe a couple months and then everything will be fine. And it's pretty clear now that it's been a few months and it keeps going on and on and on and on. And it's going to be going on for a while. We keep hearing that, oh, there's treatments coming. Oh, there's a vaccine coming. Those treatments and those vaccines will take a long time before they're mass produced. And that's after they're, been okayed to say that humans can have them.
Right.
If we'd have started this with the idea, this is about expectations. If we would have started this with the idea and everybody would have said to themselves, we're going to be in this and it's going to take a while. Do you think the stress would be different, or the attitudes would be different? That people would be, less anxious, less stressed? Do expectations have a lot to do with it?
Yeah, well, I think they do. And, again, thinking about my clinical hat, one of the forms of psychotherapy or talk therapy that we do a lot is called cognitive behavior therapy. You have people talk back to those negative thoughts that we all have. whether it's about yourself, like, okay, I failed this thing at work, or this thing didn't go well, so I'm a loser and I'm always going to fail at stuff. That would be an idea of a negative thought that you might get stuck in your head that we can teach you to talk back to. So part of cognitive therapy, and in fact, most forms of psychotherapy, is setting realistic expectations. Because if your goal is like this, okay, if I'm the only way I can possibly be happy is if I make this much money, I have this big of a house, I have this perfect of a relationship, whatever, all these unrealistic things, and your real life is down here, you're always going to be unhappy because there's a big gap. So you're right, you can either try to elevate the reality, or you can bring the target, the goal down to reality a little closer. So I think I think you bring up a really great point again, and I think setting expectations and making them realistic is really, really smart. And you're right, this thing, again, I don't know. I don't have any insider information, even though I work at a world-class medical center, and we have amazing people that work in research and in clinical work with infectious disease, and these are like, international experts in this. I don't have any insider information about when it's going to be, quote, over, and what does being over really mean? What's it going to look like? What is the new normal going to look like, and all that? But I do think it is safe to say, as you're implying or saying, is that it's going to go on a while. It has gone on a while. It's going to keep going on a while. And I think you're right. We just have to be realistic. Because if we go into this thinking, okay, just one more month and we're clear, I think we've gotten past that. Hopefully most people have, but if not, I think we need to get past that mindset, because it'll just be by Thanksgiving or by Halloween, boy, we're back to normal. That's going to set us up for disappointment. I think we have to sort of go into this with our eyes wide open and figure out how to adapt, not hoping for things that are unrealistic.
So right now we've seen all these shutdowns. We've seen people isolated, job loss.
Yeah.
I quit drinking in April, and I started walking 4 miles a day, which for me to quit drinking was honestly shocking to everybody around me. I guess I just brought that up, but there's going to be long-term consequences from this. Do you have any idea of what you think those might be?
Yeah.
And what I tell people, normally I would, like you said, I'd be talking about college football or college volleyball. We speculate all the time, so speculate away.
Okay. Well, I guess, first of all, incidentally, congratulations on 2 big things that you're doing for your health there, the drinking and the walking, or the exercise. Man, that's great. And, one thing I should say, maybe talk about speculating. I mentioned, for example, stress is not all bad. I remind people when I give stress talks and stress management talks, stress is a 5-letter word, not a 4-letter word. So stress isn't all bad. Some stress is good. Same way here, the pandemic, boy, it's I don't want to sugarcoat things in any way and say everything's great and going to be rosy. It's a bad thing, and it's caused a lot of problems, and it's going to keep causing some problems. Having said that, some good is coming out of it, just as you have done in your life. I think a lot of people are using this time to kind of reflect a little bit and say, what's really important to me? Reconnecting with family. I think a lot of people are reconnecting with family members and friends maybe they haven't talked to in a while. I think that's a positive thing, and I hope that continues. I hope that isn't just one of those things we do for a while and then eventually when the dust does finally settle, we stop doing that. I hope that's something that endures. What are the other long-term consequences? So there will be some positive long-term consequences, I do believe. In my line of work, again, in healthcare, we have switched to Zoom visits for taking care of our patients, especially in psychiatry. I don't absolutely have to be in the same room with my patients at the same time. I don't generally do a lot of physical examinations where I have to listen to their heart with a stethoscope and do things that other physicians might have to do. I do mostly talking and observing. I can do that with Zoom. And that's 100% of the way I see patients now is through Zoom. And the rules have changed during the pandemic to make it easier for us to do it. They've relaxed some of the rules that used to get in the way. I hope that endures too, because I think a lot of patients are finding this to be very convenient. They don't have to leave their home. Some patients, what about a patient that's 300 miles away in central Nebraska that wants to come see me? come on over. It's it
Right.
doesn't, from my point of view, seeing you, whether you're in Omaha or you're 300 miles away, it doesn't matter to me because it's all the same way. And it used to be they'd had to drive in those 6 hours or whatever. They don't have to do that anymore. But even if you live here in town, you don't have to come to a waiting room and be around potentially sick people. You don't have to wait. We can see you from from your own home. That's something we were not able to do 6 months ago. The rules would not permit us to do patient care to a patient that was in their own home. So I think that will be a positive thing that endures. Having said that, what are some of the negatives? Well, we don't know, or at least I don't know, what the long-term economic consequences are going to be. All right, that's something we're going to have to figure out. And again, that's kind of way above my pay grade, but it's clearly super important. I think healthcare, I mentioned some of the changes that I think are happening there, and I think will probably endure. And I mentioned again, societally and just kind of socially, I hope it helps us continue to be reconnected with people. I think as a society, we've kind of gotten disconnected from one another. Before the pandemic, I'm talking before the pandemic, we're so busy, parents with young kids, they've got so many extracurricular activities. Great, sports are great. I'm not dissing sports in any way, but sometimes, families before the pandemic were running hither and yon all night, every night of the week, going to different places, and families don't have time to have dinner together. Well, guess what? Families have time for dinner together now. They don't have a lot of other things to do. I'm seeing people out on the trail. I'm fortunate enough to live near a hiker or biker trail, and I'm seeing a whole lot more people out there than before the pandemic, including families with young kids. What a great thing, getting outside, getting some exercise together. I hope that endures. So again, I guess I'm trying to paint, there's going to be clearly some negative consequences that are going to endure. And again, from a mental health point of view, what about depression? What about anxiety? What are the lasting effects? We don't know, but I think they're going to be there. But there will be some positive things too.
You would think that there'd be this, I don't know, like a break, you know what I mean? There's always a bell curve, but you'd think that those people who have resilience built in or understand resilience are going to become more resilient, but those people who are vulnerable are going to be way more vulnerable. So there's going to be this, where there was this middle ground. It seems like there's going to be much more difference between the highs and the lows. Yeah,
I think you're right. I think it does. One thing I've been thinking about a lot in the last month or two is the way the pandemic has really exposed problems or put light on problems that were always there, socioeconomic problems. Again, we're talking a lot about systemic racism these days and things like that. That's not a new problem, but I think the pandemic is maybe highlighting some existing problems. So yeah, certainly if you have stresses from your socioeconomic status, for example, you're going to be, you may have fewer tools in your toolbox to cope with things. People that live alone. I mentioned older adults living alone, for example. No, again, not to say every older person that lives alone is lonely, because that not necessarily, but a lot of them are. And those folks, people like me, I'm fortunate enough to be married and have a family and all. And so I'm quite fortunate that way. I have sort of a built-in social network, but not everybody does. I'm healthy enough, I can get in my car and go for a drive if I get bored or something, but a lot of people can't do that. They don't have that transportation option or whatever. And so I think you're right. It does highlight those discrepancies, I guess. So going back, one last thing, I'm sorry, but the other thing is that you're kind of talking about, I think too, is what about folks that start out with this, that already have, say, a mental health problem, depression, for example, or schizophrenia or bipolar disorder. It can make those things worse. One thing we worried about early on, I certainly did, was, like the availability of medication. You remember back to the early days of this when we couldn't get enough hand sanitizer and things like that. People started worrying about, well, what about medication? What if the supply line for medication gets cut off? Thankfully, it hasn't happened. I'm for most part, most commonly used medications are still widely available. But that was kind of a worry early on. What if you have schizophrenia and you can't get your medication, that sort of thing?
Is there a particular demographic that has suffered more or less during this?
Those studies are being done right now, and I don't know off the top of my head the specific statistics, other than to say that some of the recent work is demonstrating that there are some differences. That again, when you think about vulnerable populations, again, people of lower socioeconomic demographics are at higher risk, I think. I think it is highlighting some racial differences too. And I think it's still being fleshed out, but I think it is gonna kind of highlight some of those demographic changes. Thinking about children again and the school system, many, I can't remember how many, I think it's something like 20 million kids in the country depend on school lunches or breakfast, for for a reliable, nutritious meal per day. And if schools are not open, they miss that, for example. So there's a lot of kind of unintended consequences. So, there's a lot, and I don't envy school superintendents and governors and others that have to make those decisions. Do you open a school or not, and how do you make it work? Because, there's risks and benefits both directions.
So what would you recommend to people to keep you mentioned at the start of this that you're in charge of wellness for young people, which I can tell you when I was at 20, wellness meant I go party a lot.
Yeah.
Right. And now I can't do that. So not only just the young people, but people like me, I work in IT, I work remotely, and I work at home almost all the time now. That's quite a different discrepancy in recommendations on what would you do to keep me mentally well. But if you can give some pointers, please. For sure. And again, I think that's a great thing to talk about. So interestingly, before the pandemic, I used to talk a lot about what I call the 3 R's of wellness, relationships, routines, and relaxation. Sometimes the 4th R, reflection. It's kind of like, I think of relaxation and reflection kind of go together, 3 or 4 R's. Interestingly, though, after the pandemic, guess what I talk about? I still talk about those same 3 R's, and I think they're really kind of the keys to this. So I think relationships, again, super important. We are social animals. When we are around people that we like or love, we produce a brain chemical called oxytocin that you may have heard about. Some people call it the love hormone. And the more you're around people, especially people you like, the more oxytocin you crank out. And physical touch brings that out too, even more than just being in the same room. Well, guess what? Right now, we can't do a lot of those things. So we have to settle for virtual visits, but that's still better than nothing. One thing I would say too, when it comes to communicating, that it's better to do things that are done in real time. So in other words, a video visit or a phone call in real time is better than texting or emailing, because even though we're not in the same room, this real-time communication seems to be healthier than asynchronous communication, which is kind of interesting. I mean, it's still not bad, and I still send texts and emails, and I'm sure you do too. And nothing against IT, but I do think live conversation is always best. So anyway, that's the relationship piece, staying connected as best we can, and following the rules, but staying connected. So that's the first R. So routines. So you mentioned some of the coping strategies that some people do, not just young people. Sometimes partying, sometimes drinking too much, sometimes using illicit drugs. Those are coping mechanisms, in fact, because they do make you feel better in the short run. So that is, in fact, a coping strategy. It's maybe not the best coping strategy, of course, because we all know that, drugs and too much alcohol can lead to very serious consequences. So those are not coping strategies I recommend, of course. But what are some good coping strategies? One thing I'm really focusing a lot on with healthcare providers and our students is sleep. I think sometimes we undervalue how much of a role sleep or sleep deprivation plays. They've done studies with college students that are not anxious, and then they put them in an experimental protocol where they sleep deprive them for a little while, and then they ask them to rate their mood, and they start getting anxious. So not just sleepy, but they actually get anxious if they get sleep deprived. So if you're feeling kind of stressed out, one thing I tell people is try getting an extra half hour or an hour of sleep. Maybe I think sometimes one of the coping strategies we use is immersing ourselves in media. And again,
I do the same. I'm not a Luddite. I'm not saying don't use IT, but maybe too much of a good thing is not a good thing. So too much web browsing instead of sleeping, too much social media, etc. Too much news consumption, incidentally, because you watch the news and it can really stress anybody out, right? So I tell people I think of news media, I think of the media right now as like a really powerful medication. If you need that powerful medication, and we all do, we need to stay informed, take your medication. Don't overdose on your medication, because too much of a good thing's not a good thing. So anyway, I tell people you might want to, throttle back on your consumption of media, whatever that is, for maybe an extra, cut back a half hour and go to get an extra half hour sleep. So start with that. So that's one of the routines. Exercise, you mentioned. I'm a big believer in that. I try to get, half hour to an hour of exercise most nights if I can. I personally bicycle because but that's my thing. But whatever your thing is, it doesn't matter as long as you get out and move. Being out of doors, incidentally, is really good for the brain and the rest of the body. They did a study in Great Britain. They found that if you spend about 2 hours a week outside, whether you're moving or even just sitting there on your porch having coffee, 2 hours a week seems to be kind of the sweet spot, and your health and your well-being will tend to improve. So there you go. Now, obviously, if you get out and walk at the same time, that's 15 minutes a day or something like that. But if you do both, if you get exercise while you're outside, take advantage of this nice fall weather. You get 2 for 1. You get a double word score, as one of my mentors says. And like it's a Scrabble game. You get a double word score if you do both together. So anyway, so sleep, exercise, healthy diet. Sometimes one of our coping strategies is maybe overindulging in the comfort food. Again, I'm not here to say don't have ice cream or don't have your favorite thing, but you might want to kind of watch that, because sometimes we overindulge, and I know how that goes. There's some evidence now that if you kind of push more fruits and vegetables, really try to get 5 to 7 servings a day, you will tend to be somewhat happier. It kind of changes the microbiome in the GI tract, which actually has some brain effects, maybe, we're thinking. Who knew? So anyway, so those are simple things, so routines. So that's the second hour. The last one is reflection or relaxation. I teach a lot of my students how to meditate. It's actually not really hard to learn, but you got to practice it. One real simple thing, though, if you don't want to spend 10 or 20 minutes a day meditating, one real simple thing I tell people to do is to slow down your breathing. If you're anxious, it actually really makes a difference if you take slow, deep breaths. And what I tell people to do is count to 6, not out loud, just inside your head. Count to 6 as you take a breath in, hold it for about a second, count to 6 on the way out. And that's hard on the way out, counting to 6, because we don't normally breathe that slowly. You do that about 4 breaths in a row. So 6 seconds in, 6 seconds out, times 4 breaths. You will tend to feel calmer for a while. It's simple. You can do it while you're driving. You can do it in a movie theater. If you go to movies, you can do it whenever. It's pretty simple to do. And it kind of tends to de-stress your nervous system a little bit. One last thing. I'm sorry, go ahead.
Well, I was going to say that last thing about relaxation and breathing, it might be, people might want to know that so they can get through this election, let alone the pandemic,
Yeah, no kidding. Interesting times for sure. Interesting times. One last R, though, that I kind of forgot. So I mentioned reflection. What the heck does reflection mean? Well, that means, sometimes just thinking about what matters to you, what are your goals for life? Because we still have to have goals for the long term, even though your goals for right now might be kind of temporarily postponed. Gee, I want to go on a cruise in December. Well, you may not be able to. So a short-term goal like that might have to be postponed, but still a long-term goal. I want to get a degree in such and such, or I want to ultimately live in this other part of the country, whatever it is. Those long-term goals are still really important. But so that's part of reflection. But here's a simple piece of reflection: keeping a gratitude journal. A gratitude journal. There's actually a whole science on gratitude. And normally when you think of gratitude or thankfulness, I thinking ahead, Thanksgiving's a couple months away, I think, right? September, October. Yeah, so it's a couple months away. But Thanksgiving can be every day. And it turns out there's a number of scientists that have studied this. There's one in particular in Sacramento, California, that's done a lot of work on this. And he's found that if you write down, and it really you got to write it down, not just think about it. If you write down 3 things you're grateful for once a week, twice a week, something like that, after you do that a while, your brain starts changing in some good ways. And it helps you start looking for positive things around you. Because right now it's real easy to see the negatives. There's all kinds of negatives around us. But there's also a lot of positives, but our brains filter out the positives sometimes when we're under stress. But if you start writing down the positives, it actually changes the way your brain perceives the world. So keeping a gratitude journal, I personally do that. So once a week, I write down 3 things, and I try to come up with 3 new things every week. And it kind of forces me to look at the world a little differently.
Do I have to actually write them with a pencil?
It actually matters. It actually does
matters.
It? Yeah, it actually. Now typing, some people say typing might be okay. Again, I'm not I like computers too. So again, I'm not an anti-IT guy, but doing something where you have to take your thoughts and turn them into a physical action, typing or writing, actually is kind of the secret, because it makes your brain process the information differently than if you just think it or say it. There's something different about the act of writing things down. They found, for example, students that are in class, if you underline things in your notes or in a book, it doesn't really help you retain information. But if you hand write some notes, like what the professor is saying, or you hand write some things that you took out of a book, you remember it a lot better. So there's something about writing that slows down your brain and makes it process information a little differently.
Oh my God, my writing looks like a 90-year-old meth addict dementia patient. I never write anything. I actually here, I'd show you this. This is a voice recorder. And I have a microphone I wear when I walk my dog, and I do journaling that way, and then I transcribe it.
Yeah.
So that's how I do it, and I keep track of my life. And then I go back and look at, my God, you're a horrible person. I have one more question, and then I'll let you go because it sounds like people are after you. You're a busy guy. But do you think that the mental health aspects of this pandemic have been largely ignored in favor of reporting on infections, masks, and death? Mm-hmm. And, the negativity or I suppose the more sensational parts of the pandemic?
Yeah, I would say they have not been highlighted, maybe is the way I would frame it. Maybe that's my way of interpreting it. I think, especially when the pandemic was first hitting our shores and we're still just trying to understand how is it transmitted and what are the symptoms like and all that, and what, how do we keep people alive if they do get it and all that. I think necessarily we had to focus on the biology of the thing and the infectious disease element. So I think mental health pieces are clearly super important, and that's what's particularly important to me. But so I don't know if I don't think they've been deliberately overlooked or whatever, but they have not been highlighted for sure, because I think folks were just trying to figure the darn thing out and trying to keep people alive. But now that we're getting a better handle, again, we clearly haven't figured the whole thing out, and how do you prevent it? How do you treat it? We know a lot more than we did 6 months ago, but I think now we really are starting to see more of the mental health aspects. But think about that too. It's not that different from other like natural disasters, like a flood. Think about the wildfires in the West Coast, all that sort of thing, or tornadoes. You always worry about survival first. So if a tornado comes through town, let's survive. Let's get through that. We'll worry about the other aftermath later. And so I think that's kind of where we're at with this. Now we're starting to become more aware of the mental health aspects as we get at least some kind of handle on the physical aspects of it. I've seen that play out before with other situations like this.
I've brought this up before. I know I said one more question.
Yeah.
I think our problem when we look at medical problems is we've seen episodes of Dr. House. Mm-hmm. And in Dr. House, there's some person comes to the hospital and they have a malady or, whatever the technical term is. Mm-hmm. And in 45 minutes or 50 minutes, Dr. House solves the issue and finds some amazing illness no one's ever heard of in their lives. And it's all wrapped up in a bow, and they send the patients on, and Dr. House himself is a wreck, but that's part of the show. But, the packaging, and that's not the only show. When you look at doctor shows, they're packaged into a segment, and we go, oh, you show up, the doctor diagnoses you perfectly, and you go on your way. And of course, there's this implication of happily ever after. And
Yeah.
that is none of this.
Right.
And that goes back to what I said about expectations.
Yeah.
I think it's a real problem when we look at medical problems in healthcare.
Yeah, right. Because rarely do we wrap things up with a bow so neatly. Or, I think a situation comedies, we got a 30-minute situation comedy comes down to 22 minutes of actual content. And so, inevitably, there's some dramatic element or a conflict. But by golly, by 22 minutes, they've solved it. By that last commercial break, they've figured it out, right? Or you're right, a medical mystery like House. Yeah, we get it all wrapped up and we figured it out. And you're right, not realistic. And that's true for anything that I can think of. Or there are a few illnesses that have been figured out, and kind of solved. Certain infectious diseases that pretty much don't exist anymore. Certain surgical conditions where an operation fixes the thing, you never have to worry about it again. Certainly, but most medical conditions, most psychiatric conditions have some degree of, chronicity to them. And certainly this pandemic is, the more we learn about it too, right? The more we're hearing that, most people thankfully have mild cases, get better quickly, go on with their lives. Some people not so much. They recover and then they still have fatigue. They still have headaches. They still have whatever. And, that's biology for you. Biology is messy and complicated.
All right, we're going to end there. I hope that I can have you back at some point when we learn more about what's going on and maybe we understand outcomes and maybe we can do another wellness talk because I think everybody could use that.
I agree. I'd love to anytime. Yeah, that'd be great.
All right. Thank you. Thanks to Dr. Wengel for joining me. Thanks to listening to John's Post-Life Crisis, and go Big Red.
Go Big Red.
And there you go. We're done. Now you can go respond to stuff.
Sounds good. Well, I enjoyed this. Yeah, you're a great interviewer. I really like doing this. So.
Oh, thank you. Yeah. I hope that other people recognize that and I get more downloads, but we'll see what happens.
I think so. I mean, you got a good style about you. You're kind of just real folksy and relaxing. I like it a lot. So.
All right, cool. Then I'll bug you again at some point.
Sounds good. Look forward to it.
Take care of yourself.
Yeah, you too. Good.
Right.
Congratulations. That's great. Good stuff you're doing there.
All right.
Okay.
Take care.
You too.
Bye.
Yep. Bye-bye.